Yep. Okay.
All right, so dissection of the sheep heart. We're looking at all the structures on your list for dissected heart. Start with apex. Apex is going to be right here. As you look at the shape of the heart, obviously looks more pointed. The apex is going to be a landmark to tell you your left. All right, so this is, if we find the apex here, then we know the large chamber above it is the left ventricle. All right, so that means here's my interventricular septum. The ventricle on the other side has to be what? That's our right ventricle. So find apex. You know this is left ventricle, then this must be right ventricle. We know we are on the anterior. The posterior will look a lot messier. You'll have vessels coming in all different directions. So I find a dissecting or a dissection specimen that's nice and clear and smooth. Then I will be able to see a large vessel coming off this right ventricle. Remember, we know this is right because there's left with the apex. So this large vessel here is the pulmonary trunk. Carries blood leaving the right ventricle, goes out the pulmonary trunk. So that's going to be nice and clean on the anterior side. And what about the small chambers? Those are called atria. Ventricles are the large chambers. Here's an atrium, left or right. This is left because of the apex, then that's going to be the left atrium. Remember the flap that looks like an ear is actually called an auricle. The chamber itself is the atrium. All right, so that whole structure there, now there's no blood in it, so it's pretty flat. Left ventricle, left atrium. Right ventricle, right atrium is hiding in the back. It won't necessarily be that way in the living animal or freshly dissected, but it's flat. It's been flattened back there. If we're looking for other structures on your list, let's open it. I'm going to keep the orientation, and we know this was the left side because of the apex. Notice the thickness of the outer wall. So we know this is left ventricle versus right ventricle, thinner outer wall. The structure down the center, not listed on the dissected heart list, but that would be our interventricular septum. It divides the two ventricles. Remember, if I close that, I'm creating a ventricular chamber. So you can see it as, a space. These are chambers, these are spaces. So we've got on the list valves, right?
Mm-hmm.
So we've got two categories of valves. Notice it says atrioventricular valve, and that's one of these. And the other name are the semilunar valves. Atrioventricular valve tells you it's between an atrium and a ventricle. Here's an atrium, here's a ventricle. So let's open it. Here's the valve. It has cusps. So this particular valve has been broken, right?